Dear Chairman, ladies and gentlemen, I would like to present you our results from a biomechanical study about the signal-inducing bone cement, which we developed for the MRI interventions. Okay, what we did is we tried to establish musculoskeletal surgical applications for under MRI guidance, and the question is, why should we do so? Because in open MRI, where we have a lot of space, we have multiplanar viewing, we have high resolution images, we have fast imaging which provide nearly real-time imaging, and the special scope is that we can see soft tissue very good in the MRI, like nerves, vessel or spinal cord, and especially the pathology can be analyzed under the intervention like neoplasms or fracture planes. And of course you have no radiation exposure. Here you can see the picture of a conventional bone cement based on PMMA, which is not detectable directly in the MRI. So what we did is to take conventional PMMA cement, mixed it with contrast agent. We took gadolinium-based contrast agent, but you can take any contrast agent, and added some protons. You always need 3 protons added to the cement. We used saline solution or a bone substitute, which is based on calcium phosphate, it's hydroxyapatite. It's a viscous, like a paste, like toothpaste. We added these compounds, we mixed it together, and then we analyzed the signal in the first study. Here you can see the results from the signal of the cements depending on the sequence. We're using T1 based T1 pulse sequences and fast T1 sequences for intervention. So you can see the results here. Different on top you see a normal T1 sequence, and on the bottom you see an interventional sequence with the HA-based cement. And the goal was to get finally, here you see in a virogel where you have a MRI-guided application in a bone cavity which you can apply the cement like you see it here. So the goal of this study was to answer the question if these cements are suitable for vertebroplasty, and especially if to compare the biomechanical compressive strength to conventional cement. The contrast agent was omitted for these tests because its percentage of the compound was less than 0.1%. So we took conventional bone cement and compared it to cement mixed with saline solution and compared it to cement with HA, the calcium phosphate. What we did is we took lumbar spine of osteoporotic patients, took 30 vertebral bodies, embedded them in beta-acrylate, and tested these vertebral bodies until failure. Then we performed the vertebroplasty 10 times with the conventional cement, 10 times with the cement with saline solution, and 10 times with the cement with the HA, with the hydroxyapatite pulp filler. We did this under fluoroscopic control, and then we tested the vertebral bodies again, the filled up vertebral bodies, and compared the groups to each other. So with 10 conventional cements, 10 cements with saline solution compared to 10 cements of the HA cements. Here you see the pictures at the bottom with the cements in the normal T1 sequences. Well, the results were that the initial strength of the vertebral body was about 1,000 Newton per millimeter, and it raised in every group for about another 1,000 Newton per millimeters up to 2,000 Newtons per millimeters. These results were highly significant for all groups, so all cements raised the compressive strength of the vertebral bodies. Manufacturing as a secondary key endpoint was feasible. The manufacturing, the mixing was not an issue, and the application through a conventional vertebroplastic needle was not a problem as well. So what can we conclude? We can conclude that these cements regarding their compressive strength are suitable for the vertebroplasty, but of course limiting that we did no cyclic testing, and we only tested the compressive strength in this first study. What is the outlook? Maybe this cement can provide surgical applications like tumor filling or vertebroplasty under MRI guidance. It could improve the postoperative diagnostics for so-treated spines, like in vertebroplasty, and the outlook is that we can perform a better visualization using, like we see here, fat-suppressing pulse sequences to have even a better signal of this cement. Thank you very much.
Thank you.